Hello everybody, this is Dr. Haley again. Today's topic is auto accident injuries, and I want to just go over some of the basic biomechanics of what actually happens to your spine if you're unfortunate enough to get in a car accident. Unfortunately, in the United States, tens of thousands of people each year suffer injuries directly related to automobile accidents. And how does this occur, and why are these injuries so bad? Well, for demonstration purposes, we're going to look at the fixation stick. This is a model that we use in the office to determine range of motion and show people about fixated vertebra. Okay. Now if you look here, just imagine these balls are vertebra, and for simplicity we're going to say this is a whiplash scenario. We're looking at a cervical spine here. Okay. The joints in the yellow here can move, and you see they're freely movable, and even underneath they're freely movable. But what's going on with these red vertebrae right here? Okay, they are what we call fixated or locked in position. Chiropractic, we call this a subluxation fixation. How does that occur? It could occur from trauma. It could occur from lifestyle over a long period of time. It could occur from any kind of injuries, sports injuries, work injuries, and just not taking care of your spine. But in our example, this occurred through trauma, through an auto accident. So as we're looking at this vertebra, pay attention here. As I said, they're supposed to move pretty normally. But as you get closer to the fixated vertebra here, the joints that are not moving, usually above and below, you might see what we call a hypermobile segment. Now if that continues to be hypermobile, because it has to do more of the work, because these joints are fixated, it can become degenerative of time. It can start injuring the disc, and that's where you see a lot of disc degeneration that you might see on an MRI or X-ray. These vertebrae here have to be normalized. If they don't regain their normal motion, then they will suffer along with the vertebrae above and below. A lot of times when people are in automobile accidents, we take x-rays, we look at MRIs, and we see a lot of disc problems. Now from an automobile accident, because the trauma is so great, you could actually herniate a disc or bulge a disc out just from impact. Okay? And we use MRI studies to determine that. Now, if you look at this situation here, so let's just say it's a whiplash situation, I get hit from behind. This would be where my nose is, this is the back of my skull here. If I get hit from behind and I go back and forward, what happens is the muscles, the ligaments, and the joints are going way further than they're normally intended to be. If you watch my range of motion now, I can lower my chin to my chest, and I can look up as far as I can to the ceiling here. That's normal range of motion for me. Now, just imagine I get hit by a car, and there's a big impact from outside. My neck is going to go beyond where it's meant to be. I'm going to put stress on my ligaments, I'm going to put stress on my disc, I'm going to put stress on my muscles, stress on my joint capsules, stress on my disc. There's the severity of injury. Now, of course, there's a lot of different factors that go into play. Not everybody's equal. There could be two people in the same car at the same time and have totally different injuries. There could be two people that have similar type car accidents and have different severity injuries. There's a lot of different factors that come into play there, and each factor has to be evaluated on a time evaluation. My tip is, if you are unfortunate enough to get in an automobile accident, and like I said, tens of thousands of people each year will get in car accidents and will have injuries, you should get them evaluated as soon as possible. The quicker you can get evaluated for injuries and start getting some technical work and some soft tissue and chiropractic work to these areas here that will lock up on you, the better off your prognosis will be. If you delay it, if you wait too long, the prognosis won't be as favorable. So my advice is, if you are in an automobile accident, seek medical attention quickly. Okay? Don't downplay the symptomatology. We get a lot of people that downplay the symptomatology. They will get in an accident, and for some reason they'll say they're not hurt or whatever, but they'll have a stiff neck or a stiff back, and they think that's really nothing, it will go away. That could be the first sign of a problem later on. Okay? Like I said, everybody's a little different, so you might not feel it right away. You might feel it weeks or months later, but you have to realize the mechanism. You have tremendous trauma to your spine. You know, you're not meant to be having cars collide and be in the middle of it. So don't downplay your injuries. If you feel anything different from when you were actually in the car prior to the accident, it's a good idea to get it checked. Okay? And like I said, the quicker you get this done, the better outcome you will have. And always remember, don't wait till it's too late to see your chiropractor. Yours in health.